Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Pandemic Update with data accurate through June 23rd, 2022. This week, I'm going to ask the same question I asked last week, which is, are we seeing any change in the downward trend of COVID statistics? And then I'm going to talk briefly about the health implications of the current heat wave. Are we seeing any downward trend? Any change in the downward trend? Well, fortunately, globally, we're continuing to see a reduction in the total number of deaths, which is good news. It's the lowest it's been, obviously, since early in the pandemic. But even still, we're at their estimate over 1,000 deaths a day. So while the pandemic is coming down, it is certainly not gone. In terms of the United States, we were watching this short blip in cases. It appears to have leveled off. But it's worrisome that hospitalizations, especially in the elderly population, continue to go up. We have to keep an eye on that because hospitalizations are a good measure of what's really happening. Fortunately, the other good measure is deaths, and we're not seeing an increase in deaths. In fact, we're at the lowest point we've been at any time since the first few weeks of the pandemic, running about 225 deaths a day nationally. You'll recall that we've been sort of following this trend with the cases beginning in the Northwest. And then last week, we were looking at cases in Kentucky, but fortunately, it doesn't appear to have really concentrated anywhere. And if you look over the last 8 weeks, you see a general darkening, but really no major focus areas expected, except perhaps out in the Rocky Mountain region. I want to talk about the heat wave because it is a major public health issue that people don't talk about enough. Obviously, we're in the midst of a heat wave right now with records being set all around the place. I was in Louisville, Kentucky yesterday, day before yesterday, and it was 99 degrees. Normally, from 2004 to 2018, we've averaged about 700 deaths, heat-related deaths a year. That number more than doubled in 2021. Whether that's due to climate change or just unfortunate circumstance, we're not sure. Back from 04 to 18, we'd see about 67,000 emergency room visits a year and about 9,000 hospitalizations. So this is not an insignificant problem. Now, obviously, anyone can suffer from heat, but there are some who are particularly vulnerable, particularly pregnant women, people with heart and lung conditions, young and old, athletes because they train outside, and outdoor workers. Urban areas tend to combine both having an elderly population and increased heat. We do see significant differences by race, ethnicity, with American Native populations being about twice African American, which is 50% more than Hispanic, and white, which are double Asian Pacific Islanders. I suspect much of that is due to underlying social conditions, but it's certainly something to be aware of. The Tennessee Department of Health has issued some guidelines on how to avoid heat-related illness, and these are useful. Stay hydrated, avoid alcohol, take plenty of breaks, move to a cool place, and so on. I think the CDC is a little bit more comprehensive. Never leave people or pets in a closed car. If air conditioning is not available, go to a cooler place. I always thought San Francisco was pretty cool. Take cool showers or baths, wear loose, light-fitting clothes. If you're outside, find shade, drink plenty of fluids, and take care of each other and take care of pets as well. Now, the two major illnesses that you can get from heat, there's a lot of conditions related to heat, but obviously heat stroke is the most serious. You get a high body temperature, red, dry, hot skin with no sweat, rapid, strong pulse, and often confusion. If you suspect someone has heat stroke, get them to the emergency room immediately. Call 911, get an ambulance. In the meantime, while you're waiting for the ambulance, cool them down with whatever methods are available, but don't give them anything to drink. Heat exhaustion is this combination of less serious conditions, but it can be difficult to separate. But obviously, get someone to a cooler location, cool them down by removing excess clothing, sips of cool water. If the symptoms continue, contact a healthcare provider. There's no fine line between heat stroke and heat exhaustion. I would say, if someone's not sweating, they get a high temperature, they become confused. Any level of confusion it certainly warrants a visit to the emergency room as soon as possible. Heat can be a serious issue. It's worse in some populations, but it can happen to anyone. So are we seeing a change in the downward trend? Yeah, no, not really, except we keep our eye on hospitalizations. And then the heat wave, of course, poses a significant threat to us all. A great deal more information about public health issues on the public health website. If you know anyone who'd like to be added to this mailing list, please let me know. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, if you have any questions about COVID, heat stroke, monkeypox, or any other emerging public health issue, please let me know. I look forward to hearing from you. Until next week, be well.